they're offering the vaccines for nursing students and faculty that are assigned at the sites. And right now they're not requiring them. Our MA students, that's probably a bigger hurdle right now. They need the vaccines. And the other thing that we're finding is it would be a lot easier if the students could just move up the ladder to be able to get their vaccines, not just from the clinical site that they may be at right then, but to be able to get it sooner than when they go. The other thing that we've been doing here is partnering with Peace Health, and I've been asked to kind of be a liaison between Clark College and Peace Health, and we've provided right now just faculty and staff, myself, have been able to volunteer, which has been great. We've also been able to receive the vaccine after volunteering and just really learn how the whole system works, which has been really interesting. And it looks like next month, February, is when we're hoping that students will be able to provide the vaccinations, including the MA students. We're working with WSUV, so that WSU Vancouver, for some of their nurse practitioners, students to be able to go with our nursing students, so that they could provide that preceptorship without all of the faculty having to be out there. So things in the air, but that's basically what's happening this way.
So just to clarify, so students are able to gain clinical training hours, clinical training experience if faculty are present.
Well, they can only give the vaccine if they have someone observing them. So, you know, if they, for example, so medical assistants can get clinical hours by going and volunteering, cleaning, just helping out, which is honestly, it's great because it's what I did. You get to help at the door, greet, help assist students, observe our students, the patients, you know, be there to observe for any side effects. And it just, the cleaning, it's like we're all sweating afterwards. And also learning from the pharmacists, that to me has been a huge educational experience, just watching with the Pfizer vaccine, the importance of what the pharmacist does. And so the vaccinators are all waiting for their vaccines, and just, it's not like we can just pile a bunch of the syringes and bring them to the vaccinators, because it has to be done within that, you know, hour of time. So yes, they can get clinical requirements. Nursing, not as many. It's like they can get some, but what the department chair is telling me is it doesn't meet all of the outcomes for, you know, what they require for their clinical experience.
Thanks, Brenda. Vicki, you want to add to that?
Yeah, I just was looking at the chat and I see that Leslie, hi Leslie, she makes a very good point that depending on the level of nursing students, so if they're pre-licensure, they do need that supervision. They do not have the, you know, kind of that liability coverage or the license to do that. So that's why for most of our opportunities, we have to make sure that the faculty are there with them, that they have that provided with that oversight. So that's exactly right.
Yeah, so I read a blog, a health science blog from Washington State University talking about their nursing students in Spokane providing the vaccine in the community, and how they really felt that this was, because they have a fairly diverse student population, that this was a good opportunity to kind of model acceptance of the vaccination by kind of a cohort of workers providing vaccinations that are diverse backgrounds. What do you think is the role of the community colleges? I know this is kind of a loaded question, What do you think is the role of the community colleges to work with industry to really address hesitancy, particularly with uh, various populations around vaccination? What are we doing to help with that?
Well, Dan, I'll jump in. I love to hear from others too, but I'll jump in. And that's a huge concern and focus of mine, actually. And I think we talked about this in the meeting prior, but I think this is a huge component. Right now, we have a lot of need for the vaccines, and we need people to give it, and we're kind of in that stage. As we go through, and then we get to the point where a lot of the folks who want the vaccine will have been able to get it, and what about the others? How do we provide that education going forward to make sure that we can get people vaccinated, as many as we can, and what does that involve? So I know I've reached out. There's a plethora of people doing so to make sure they can help with the actual vaccination effort, whether it's in the pre-check, the injections itself, or the post-surveillance. But I'm also concerned about the educational component that I would love my students to be involved in, and that is, how do we promote what the vaccination is all about, what COVID's about? How can we contribute to that piece of the effort of making sure we can allay any, I don't know if we can do that, but just at least to provide that education, especially to diverse populations, to make sure that they understand. I think it would be hard. I'm in healthcare, so I know where to get the information, but for some of us, I think it is hard to get accurate information that you trust, that you believe in. How can we contribute to that effort? So I would love, I'm looking around at the tiles here, but to kind of work with people on that particular aspect of this COVID vaccine effort.
Brenda, do you want to add anything to that in terms of what's happening south of us?
Well, I can echo what Vicky said. I also just shared an article that I have not read because I got tapped on the shoulder, half an hour ago to be here. So help, department chairs, what do you have? Anyway, she sent me, so I put it in the chat, an article that she said is good about why communities of color might be resistant to the vaccination. And the other concern I have is, and what we're talking about here, is how to get that education to the communities, because a lot of them, they don't want to come to us. So how can we come to them and partner with our with healthcare partners?
Yeah, great question. Great question. And maybe we'll be tackling that later in this meeting. So I want to shift gears slightly here and just kind of tackle the other kind of challenges that the community colleges might be facing. I know that in a meeting yesterday, I was hearing from an administrator at the Lake Washington Institute of Technology around the financial impact that COVID is having on colleges and their kind of capacity to adapt to unique environmental circumstances, particularly around things like most students now are working online. And so there's issues of access, there's issues of technology. Actually, I think very similar to what the healthcare industry is experiencing. So a lot of the huge financial impact, and we're kind of wondering who's covering the cost of that. Vicki and Brenda, what are some of the other challenges or issues that I think our industry partners might want to hear about resulting from this pandemic?
Well, what I've learned is there is really a need for support for new grads, like more mentoring in the healthcare facilities for those graduates who may have experienced more simulation than face-to-face with patients, and so they have less clinical experience than usual. So what we've been doing also with our primarily hospitals and clinics is working with the health education area and working on a type of mentorship program that might help. Also, how can we partner to support this successful transition to practice, during these challenging times. Anything that we can do. It's tough. So Vicki, your turn.
Okay, no, and I want to, Brenda, I appreciate those comments because those are probably exactly what I was going to say. I think one of the things that I'm eager to do, and all of us are, and that's to really partner with you folks. I mean, we are putting out graduates who are a lot less confident, who will have less direct patient care hours. And how does that impact not only their success, but their retention and their ability to really thrive in that environment, given that they will have looked different than graduates previously. So I'm particularly interested in healthcare partner perceptions on how these new graduates are doing. And again, what can we do on the education side to promote what you're doing in the healthcare industry side to make sure all those things are happening? So I think that's a huge piece. The other thing I was going to say is, and I'm thinking long-term care as well. This is something I know there's a lot of extra challenges when it comes to long-term care, healthcare partners, in terms of they are managed by companies oftentimes out of state. So how can we work together with our long-term care partners? Because that's really not where we're even able to get in. Most all of our nursing programs are not able to get in to long-term care facilities. And how can we work together to try to make try to help them get the help that they need, and we can get the experience. But I think it's about how can we work together to make sure that these things are happening.
Thanks, Vicki and Brenda. I want to bring up just one other piece of this that we've had in a number of meetings, and that is just kind of paying attention to the health and the behavioral health of the workforce, the students who are going to be going into the workforce, and actually, frankly, the faculty that are kind of mentoring those students into the workforce. And so I think we're looking for opportunities to partner, to collaborate, to think creatively out of the box around looking at setting up resiliency programs for those in the health workforce. And I would welcome, and I know our deans and directors, our faculty would welcome partnering with our clinical partners around kind of a long-term plan to support kind of the behavioral health needs of the workforce. So with that being said, I think we're just about at time. Thank you, Vicki and Brenda, for your contributions here. And Ryan, I guess we can pass it back to you, but we're going to hang around for a while and hopefully we'll have a good conversation.
Absolutely.
Ryan and Dan, if I could respond to number 4 on your list. I always hate to miss an opportunity, right? And that's update on enrollment. And I just want to report that pretty much we're experiencing it, and it's the experience across the state, that enrollments to our programs have gone up. I mean, they've at least minimally remained steady, but they've gone up. And we're very excited about that, but also kind of looking at the variables behind that. We know that obviously nursing and other professions, interprofessional education, but anyway, professions have been kind of highlighted in the news. So it's really nice to see that people aren't scared off by what they see on the news, that they're coming in. Part of it may be that they're eager to kind of be a part of all that and give back to help out. But the other part is, maybe that redirecting workforce, right, from people who may have lost positions and lost jobs and coming into healthcare. I think we all have to kind of sit back and look at the people who are coming and for what reasons, and making sure, again, that in our changing nursing education arena, that we can still put out some quality graduates. Thank you.
No, that's really great to know that, because definitely with the news, you would think that some people might be scared off, but to know that people are stepping up and saying, this is a challenge that we need to face together. And I want to embark on a journey to be a part of that is, I think it's a great testament to the colleges being, open and welcoming and letting folks know too that the programs are still up and going. So that's fantastic. So thanks to all three of you for those great comments. I think there were things that were brought to the attention that probably everybody in the call was not aware of, which is again part of the reason for the information exchange. For one, I had never thought that all the lab staff at the colleges, that was just something. It's like, oh my goodness, yes, you can do your best to keep a 6-foot distance, but at some point when you're doing a simulation or you're doing something, that's not always possible. So some folks that might be overlooked, so great to be able to highlight some of those things. So thank you so much. And again, as we go into breakout groups at the end, we'll definitely have for our other education partners that are on the call an opportunity to hear from your ends, whether you're echoing things that Vicki and Brenda were able to share out, or whether there's something new from your lens in that smaller breakout session. So with that, we're going to pivot over to the industry side. And Kim, great entrance. I see Kim Anderson has just joined us with perfect timing as always. But we're going to hear from a couple of our different industry partners. As you can imagine, this is a really busy time for our healthcare providers. So a couple of our usual suspects were not able to join us today, but did send some things. So Angie Graves from Aegis Living, which, as again, our college partners brought up the long-term care. She sent an email with a couple of different updates and apologizes for not being able to be here today. So number one, she specifically wanted to address Department of Health sent out a tweet over the weekend in a press release that said everybody in nursing homes had been vaccinated 100%. Well, she wanted to clarify that was really only in the skilled nursing facilities, that memory care units like at Aegis or assisted living, so on that scale of longer term or elder care, that is not the case. So at Aegis, for example, she was saying that there are about 3/4 of their staff have received the first dose. And then they're waiting they're now in that waiting period to receive that second dose. And she did note as well that once the vaccine is more broadly available, at some point they will be requiring that for employment. So they have already adapted that particular policy. And with respect to clinicals, it really isn't on their radar yet because they're still worried about getting the vaccine out to folks. That's where the focus is now. But they're really trying to focus on once they're there and then being able to return to the table again for clinicals, recognizing that they're a really important part of the talent pipeline and clinical ecosystem. So just some updates from the long-term care thing. So again, I think that's really helpful clarifying where we are in the vaccine process and where the state has been prioritizing some of those things. So with that, I'm going to turn it over to Kim. And Kim, thanks so much for joining us today. I know you are crazy, incredibly busy right now and leading some of these efforts. But just based on the great update that you gave our board last week, if you could just kind of share what you have been doing at Swedish, some of the challenges, some of the opportunities that might be there, and then just any insights you have into how things are going.
Certainly, happy to. Can you hear me, Ryan?
Yes, we can.
Good. Okay, great. Thank you. Yeah, well, I'm really excited to be here. Thank you, everybody. And I appreciate the opportunity to kind of keep healthcare and education in touch as we continue to need to develop a workforce, especially in these times when the healthcare industry is really responding to COVID. So yeah, Swedish has been placing a lot of organizational energy on getting vaccines out and available. We of course we were one of the very first organizations to receive the vaccine in mid-December and had immediately spun up caregiver clinics inside of our campuses. So folks who we employ, but also, agency, traveler nurses, vendors, folks who come into the hospital because they are in a high-risk setting where, patients with COVID are. So we managed to get many vaccine out through those campus-based clinics starting in mid-December. And on January 2nd, and we've got this documented in kind of a PowerPoint presentation, on January 2nd, our chief operating officer sent a text message to our chief executive officer and said, does Seattle U have a gym? Because we were thinking about how do we take this out of the hospitals and really kind of create a better space that's more accessible, larger, that allows for greater volumes. And Seattle U had Campion Ballroom. And so you may have been there, you may have seen pictures. Campion Ballroom was quickly turned into a mass vac site. I think that, you know, the idea was born on January 2nd, and our first clinic day was days from kind of an idea to actually getting over 1,000 people a day vaccinated. And at its peak, we can vaccinate around 2,500 people at that location. It has been going extremely well. We've learned a ton. We have a playbook. We've toured many organizations through that site so that they could take from it what they can use, and we can get more sites up and running kind of across the region. And at the same time, we recognize that this solution doesn't necessarily work for everybody. You know, part of the challenge of this vaccination effort is being able to communicate with millions of people. The state developed the Phase Finder tool, which allows people to go in, take a quiz, find out if they're eligible currently for the vaccine, and then if they are, it directs them to a list of places where they can get the vaccine. But if you don't have a computer, if you aren't tech savvy, if you are if English is not kind of the language you speak at home, if you have limited English proficiency, this system is hard to navigate. And so Swedish, as Seattle U was kicking off, was also developing our mobile vaccine solution, where we work with community organizations, community partners. Those organizations do outreach, capture kind of a list of folks who are interested in getting the vaccine and eligible. And then we show up with our truck and our tents and our vaccines, and we vaccinate people on site and then come back in 4 weeks for their second dose. And that kicked off yesterday for us as well. So we are continuing to kind of stay flexible and evolve in what's needed. You may have seen in the news that our allocation at Seattle U was cut. And so that is true. We only received 1,000 this week, which meant we had to put our Seattle U clinic on pause, which was tough for the folks at Swedish. And we, of course, want to do what is best for the community. And so we will be flexible as more information about allocation comes out, in, you know, spinning up or spinning down clinics and whatever is needed. And as, you know, continue to have conversations with organizations, you know, the city and the county and other places that are talking about even larger mass vaccine sites. So just kind of staying agile there. I'm going to pause there. I would love to answer questions. I'm sure there are many, and I can't read the chat. So Ryan, if you're seeing questions, please let me know.
Yeah, absolutely. So if folks have questions for Kim, if you want to put those in the chat, and then while we're kind of getting those, Kim, do you have a few minutes to hang on, because we also have we're very pleased to have Jesus from CMAR with us today from the community clinic perspective. So can I ask him to kind of share some of their experiences while we kind of gather some of those questions?
I'm sorry, what was that a question for me? Sorry.
Yeah, just making sure. I know you're super busy today. Can you hang on with us for a few minutes, or do you need to dash off?
Oh, yeah.
Oh, awesome.
No, certainly.
Good deal. Yep. Great. All right. Well, Wonder. So we are thrilled to be joined by Jesus Valdez from CMAR, who has gratefully been able to join us today. So Jesus, I'll give you the floor, and please share out from the experiences that you are experiencing there, and there's some similarities with what Kim shared out, and some of the differences and some of the barriers as well.
Hi, everyone. Thank you, Ryan. Really, thank you for inviting me here today to speak on behalf of CMAR and share our experiences. A lot of what Kim shared rings true even in the community health center setting. We are experiencing a shortage of supply, as is the case with just about everybody else. And so for our patients, and really, I guess going back, we started doing vaccines late December, right before Christmas. We actually received our first allotment of vaccines from the DOH. And we started out with our staff, and we encountered one of our first big challenges was hesitancy, even amongst our staff. And really, we saw about a 50% acceptance rate from our staff, and a lot of our staff, I mean, including providers, MDs, MAs who are working with COVID patients every day, doing testing and such. And so it was a huge educational aspect, getting education to them, and making sure that they understood, the science and behind the vaccine, and that it was truly safe and recommended for them. We have seen that tick up among staff, and the hesitancy kind of trickle down as they've seen their colleagues get the vaccine and it's safe. And so we're getting a lot of folks that are now less hesitant and wanting to get vaccinated. But that was our first big challenge, I think. And so the vaccine process started out a little bit slower than what we're at now. We started as an organization doing about 230 vaccines per day. And we've since really ramped that process up. And 2 weeks ago, when the governor announced the rollout of phase 1B, we pivoted our operations to be walk-in vaccines at all of our clinics that have vaccines available. And that was in an effort to really reduce what I think, Kim explained, as some folks that really maybe they have the Washington Face Finder and they are not able to know where they can get a vaccine or how to sign up. A lot of the folks that were in that 1B category, the tier 1, are not super apt to use, web scheduling services, or how to do that. So we pivoted to a walk-in model, first come first serve at our clinics, and we saw a huge demand for that. And so we went from doing about 230 vaccines as an organization per day to doing now well over 1,000 vaccines as an organization per day. Like everybody else, we saw a huge decrease in the amount of vaccines that we received this week. So this week, throughout our 7 clinics that have been approved to do vaccines, we received 1,300 doses. All 1,300 doses were administered yesterday or are set to be administered for second doses for folks this week. So we will be out of vaccines on Friday. And so on hand right now, I have 60 vaccines, and they're all spoken for folks that have second doses already scheduled. So we've seen a huge spike in demand. People are finding out that they're eligible for the vaccine. They're finding out that we have vaccines. The issue really right now is we just don't have the supply. And so we've seen a pretty good response to our walk-in model. Folks are getting here really early, so we're starting our clinics really early now to really accommodate for that, to allow folks to get through. Our staff are responding really well to it. They're really excited about being part of the solution and really hope being on the ground level and getting vaccines into the arms of these people. And so we really expect as an organization to be able to keep pushing through, and as we get more supplies, to be able to keep administering in these high amounts, especially being that we serve a lot of people who are significantly impacted by the pandemic. That's being Latinos, people of color, people, essential workers who are underinsured or uninsured. And so we really are excited about the work that we have been doing. We're just hoping to get more supply here, as is everybody else I know.
Great. So there's a question in the chat. Did you use a specific education strategy to address hesitancy or reluctance? And so, Jesus, I know you brought that up, and Kim, I know we've had conversations that that's an issue as well. So I'd love to hear from both of you. But Jesus, if you want to go first?
Sure. We have made our medical providers champions within the clinics, the clinics that have vaccines, and we have allowed access to our providers from staff. And so that's including our dental staff, our behavioral health staff that have questions, allowing them open forums where they can ask questions about the science behind the vaccine and really get answers from the providers who they trust. And so that was one of the strategies that we used, including our CMO, sending out a briefing, an email, an all staff email, and just letting people know about the safety and really that it's recommended for everybody, including the link to the fact sheet that came from the Moderna vaccine as well, and so that people could do their own research and really find out about it on their own. So that was one of the strategies that we utilized that we saw a pretty good effect.
Okay. Kim, anything to add to that?
Yeah. So at Swedish, our leadership team, our chief quality officer, our head of infectious diseases, our chief medical officer, the medical leadership team, the clinical leadership team would come together. And we, since the start of COVID, really, back in the spring, have been holding town halls. So this is internally, holding town halls to share information across, the entire Swedish organization. So we employ 13,000 people, and information gets out that way. Once we put it kind of out to the entire organization, it is kind of public information. And so making sure that everybody on staff had the opportunity to ask questions, those virtual town halls, folks can ask anonymous questions, so they can ask questions about the vaccine, about COVID, about quarantining, about anything like that they wanted to ask to kind of clinical leaders at Swedish. So, we just really led with, sharing as much information as we could about the studies, the vaccine, the COVID itself, all of that. We, of course, have also been having lots of conversations about how do we address vaccine hesitancy. And I even hate to call it vaccine hesitancy, right? There's justifiable mistrust in the healthcare industry. And so how do we, kind of tackle this issue in many different ways? Swedish is an affiliate of Providence St. Joseph Health, and we have teams at Providence that are working on brief, 2-3 minute videos that are a person asking questions of a Dr. Lisa on the street. And so can we share videos like that? Can we post pictures of prominent community leaders getting their vaccine with their permission, of course, to just share that it's out there? And our mobile clinic really being co-led with community organizations themselves. For example, our first mobile clinic was yesterday. The Ethiopian Community Center was an amazing partner, along with the YMCA of Greater Seattle, and really kind of being the voice. And the YMCA was holding info sessions for the community, and then we immediately were following up with vaccines made available to the folks that were attending info sessions. Seemed to really help. And if folks were on the fence, it really helped to kind of let folks make an informed decision about whether or not they wanted that vaccine. And of course, we still hear people from all over the place saying, I'm going to wait and see what happens. And we respect people's decision about whether or not they want to take this new vaccine. While we still recommend, that based on the risk, folks do take it if offered.
Okay, great. And I see DJ3 posted a great link into the chat around, so he was saying that we've been promoting activities to help education, join a conversation for African descent communities about the COVID-19 vaccine hosted by the Washington Coalition of African Community Leaders. So that's January 30th from 11 a.m. to 1 p.m. So that link is in the chat. So definitely please join the other teams that from HealthPoint, and if we could share that within our networks, I think that's a low-hanging item that we can do to get those out. So. Well, great. Any other questions before we move into the discussion? And given the size we have today, we know we were going to be a little bit smaller just because of the time. We're going to opt not to really go into breakouts, but really kind of open the floor for some different questions. So there'll definitely be some opportunities to be able, and again, let's give a round of applause to Kim and Jesus for sharing those those insights from their organizations. And as we kind of move into the next phase of our meeting, we can definitely open up the floor to be able to do that. So in the agenda, I kind of teed up a couple questions. And so the first question that I kind of want to open the floor to be able to do is, based on, what the colleges are sharing, and then based on, what the industry partners are sharing, assuming that the vaccine supply issues, so looking a little bit ahead in the future to when those could see some relief and we start to see additional shipments in bulk coming in. Is there a way for the community colleges to really support the vaccination efforts with industry partners? And I think there's kind of two ways. One is that clinical technical part, right, that actual administration. But then the other part that has really come up in this conversation is the distrust, particularly among communities of color, distrust of the healthcare system. And do the colleges have a potential role in supporting some of those education efforts? So with that, I'll go ahead and open the floor. And again, if you are not speaking again, please stay muted, and we'll try to do this within the group. So anybody want to jump in with the ideas or get us started?
So this is DJ3 at HealthPoint. I think there's two things that are very important as we continue to move forward. The first one is reframing of the conversation as it relates to people of color, communities, as it relates to, it's not necessarily a fear, it's a learned experience. We've had these populations over time who they've been experimented on. So it's not we fear this, it's they've learned from their experience. So I think there's a reframing of the conversation that needs to go on. And I think one of the places that has to happen is in the college system. So as our future providers are matriculating through that conversation, they're having those tough conversations around, we've got to realize what happened with experiments and things of that nature and how people were impacted by those things. So that when we have these conversations around how do we move into a new vaccine, they hear them. I think the second thing I'd like to think or suggest is, as we begin to move forward, and I'll use HealthPoint. HealthPoint initially has been focused on testing. So we really got out, we opened a testing center, we're doing that work. At some point, we're probably potentially maybe going to have to recreate and start doing maybe a shot center. I don't know what we're going to call it, but we're probably going to be doing testing, or maybe it's drive-through shots or whatever. We're testing those concepts. And that is where opportunity creates itself for staffing. We cannot staff that internally. We just don't have the resources. So we learned from when we stood up the testing site, we had to go out and hire a bunch of folks. And even still, we're experiencing high turnover, things of that nature. So there may be a place here for us to partner with our education partners to get some of that practicum experience as we're standing up these organizations so that they can come in, help partner with us, get that learning, get that developing while we're still doing this vital work. So I think there's some great opportunities down the road for us to partner together to do that.
Okay, awesome. Thanks, DJ3. Just dovetailing on that second point, just want to see if there are other industry partners that potentially would have collaborative opportunities. If not today, then as DJ3 mentioned a little bit down the road, is they're having to pivot from the testing. But then I do want to come back to the first point you made DJ3, but I just wanted to open the floor for the other industry folks that might have some opportunities as well.
Yeah, this is Shauna from Children's, and I apologize, I'm gonna have to jump off in just a couple of minutes here, but I think we've had a similar experience at Seattle Children's as has been described, in the sense that we started obviously last year by ramping up our testing capacity, and then similarly, I think on December 16th, we delivered the first vaccination into the arm of a staff member. And so, I think very similar to what others have shared in terms of needing to really put that infrastructure in place. And to this point, that has been staffed internally. So we have essentially leveraged our internal nursing staff by and large for delivering the vaccinations, and a variety of other staff to help fulfill some of the administrative roles in terms of registration and the observing patients afterwards. So I think that we have had success in redeploying and covering so far. We similarly started, we extended our hours and created evening clinics to try to fulfill some of the community need. And that kind of ramped up at right about the time that the vaccine supply so those kind of went at cross purposes. So I think we're having similar experience to others. But I think where I do think there could be a really great synergy here, both in terms of how we as industry partners communicate, but also leveraging some of that students. I love what Vicki was saying about the learning opportunity of being part of that education and communications effort, because that's a really big part of going into healthcare. And there is a unique moment right now, I think, that as DJ3 described, to reframe not just the conversation about this specific issue, but around engagement in healthcare services generally. And so I would love to further explore this possibility of partnering between industry and education on a kind of a unified, not just messaging, but mechanisms for hearing, right? I think that's the biggest part about this. This is different than, we require people to get flu vaccinations, right? But we know a lot about flu vaccinations. Like, this is really different. This is new, and it's important, I think, to create space for listening and sharing information and being fact-based and making sure that you're approaching from a not a judgment place, but from a trying to get to some understanding. So I think that would be really exciting.
Fantastic. Thanks, Shauna, and appreciate you being able to join us today with the hectic schedules. Thanks to Kevin Henry, just posted in the chat another resource from the NAACP is presenting a COVID vaccine safety update. And so there's another great link to be able to share out there, and the Zoom information is located in the chat. Kevin, anything you wanted to add to that? And thank you for sharing that resource.
Yeah, thanks a lot. I just wanted to add that the NAACP, as well as Sound Health, is kind of putting together these future programs that can give some valuable information about what's going on with COVID, and also address the diversity and equity and racial elements of that as well. So that's all I have right now, but just stay tuned for more details as they come up.
All right, awesome. Thanks so much for sharing that, Kevin. Really appreciate that.
Yeah, thank you.
From our college partners, so we've heard from a couple of our industry folks talking about some of those opportunities. So particularly the learning and communication component. Is anything resonating with any of our college partners around potential ideas of how to take that from kind of a concept into some things that might be actionable? I have struck our college partners with silence.
So I'm going to go ahead and just kind of, so for me, you're kind of preaching to the choir,
Yeah.
right? In terms of, but again, I'm the preacher, I'm not necessarily the choir. I always believe that the community colleges, because of where we're located in our communities, and because of our incredibly rich, diverse student population base, that we have a incredible opportunity to be the point of the spear when it comes to reaching communities and being engaged with public health and population health initiatives. So we have great opportunity here. It's just a matter of being able to sell the bandwidth question.
Uh-huh.
I mean, does this make sense? Does this align with kind of the mission of the colleges? Does it align with the mission of health workforce programs? You know, that kind of thing. I believe it does. But again, we have to sell it to the powers that be, so to speak.
Okay.
I
Got
know
it. So
Bellevue.
I'm sorry. Who was joining in?
Sorry, this is Leslie. I didn't
Go
have my
ahead,
hand
Leslie.
up.
Oh, Leslie.
My bad. So I was just going to say, I'm at Bellevue College,
Mhm.
and we're currently an East Side testing site for King County Public Health. And we are in conversations with them about potentially becoming a vaccination site.
Mhm.
And if that does become the case, we would likely need more support that we can get through our own students. So that's one kind of stand-up idea place. Someone just sent me a great video today that the master's students at UW Bothell made, the master's in nursing students made about the COVID vaccine. And I think there are probably a lot of creative things our students could do and get out on social media around just their own experiences and getting vaccinated, because in addition to being in the community, we also have an incredibly diverse student group. So those are the first two things at the top of my head.
Awesome. Thanks, Leslie. Denise from Kaiser, just seeing if there's anything from your perspective to add to this really rich conversation. And you're on mute.
Sorry. So as you probably are aware, Governor Inslee had announced that Kaiser has been tapped to partner in distributing a mass vaccination distribution of up to 45,000 a day, with partners with I think it's Starbucks and Costco and some of the local unions, to help get the word out and figure out how to get this to the community. So we're internally looking at how we can bring the vaccine to the community as opposed to trying to get them to come to us. So we initially started our rollout with getting our phase one, getting our healthcare workers vaccinated. Most that wanted it did get the vaccine. And any volunteers to keep it going. We have about 16 locations within our clinics that are vaccinated sites. So anybody who's volunteering, whether they be our BRGs or staff, whether they're vaccinating, observing, they're also, as you heard earlier, they're getting an incentive to get the help out there is to get their vaccination earlier than the original phase planned for them. Our biggest barrier is in staffing, those who know how to give shots. So we are opening it up and partnering with colleges, Northwest College, and they are open to other colleges, having nurses to come out, student nurses to come out and help with the vaccination. So I have a contact person there if anybody's interested in partnering Kaiser in that regard. We also are starting to move into a campaign for addressing the hesitancy with listening sessions. There are 3 scheduled in the month of February for the community, as well as creating an equity, inclusion, and diversity conversation tips huddle card on how to talk effectively about the vaccines with diverse populations. They're creating a video with diverse group clinicians representing KPWA, as well as key informant interviews with Black and Latino healthcare workers and people who've taken the vaccine to advocate for others to take the vaccine. So we're we set up an area for you to be able to online to schedule your appointment online. They have a hotline available, and they're translated any material about the vaccine. They translated it in multiple languages to hand out at the clinics.
Oh, that's awesome, Denise. And we definitely had a request. We had a request from Leslie for the link for the community partners and volunteering. So whoever be that contact, I know a bunch of our college partners would love to be able to have that, especially since you have locations all throughout the Puget Sound. So that could be a great way for students to be able to connect. That's awesome. Any of our other college partners on this with questions or suggestions or ideas or challenges that you're able to face?
This is Vicky, and I don't really I have nothing really, I'll just finish. I have nothing profound to say, but I'm very eager to continue to think about this because it's such a valuable focus. So I'm here percolating ideas, but I don't have anything, again, profound to say at this time.
Okay. Well, no, and you definitely had something. Thank you so much for sharing earlier. That was the great insights, and I think we've definitely surfaced that at least at Kaiser and potentially at Health Point downstream, once vaccine supply comes there may be some real opportunities for students, either in that clinical setting or in that support setting, to be able to support this. So, at least we're kind of doing some online real-time matchmaking here for some opportunities.
Ryan.
Yes, sir.
So one of the themes, sorry for interrupting, one of the themes that came out of our last meeting that we had, I wrote down this word, it's called risk aversion. And so one of the themes that I picked up from our industry partners was there a lot of focus on the challenge of risk and what students do or do not do to kind of, I don't know, enhance that risk or create a challenging situation. And so I would encourage, rather than just accepting the fact that there's this risk averse and kind of landscape, that we figure out ways in which we can really communicate about that and address those challenges and wonder if we can specifically tackle those issues that create that risk averse environment. And so I don't want to lose that term or that momentum from that last meeting. So I really would hope that we could continue that at some point.
Oh yeah, thanks Dan for sharing that. Any of our industry partners? I know we lost a couple folks that had to jump off. Anybody, has that environment changed at all, or there been any conversations or any progress there? And I think this is a great kind of segue into our second question around because the last time we talked about the barriers to clinical placements. And really understanding, how the vaccine is really key to breaking down a lot of those barriers. And so obviously supply is that greatest barrier that we have right now, but I think you teed it up right. There's a bit of that risk aversion. So curious for any of our industry partners or even our college partners that may have had experiences on that clinical side, have there been any policies addressing vaccinations as a gateway to clinical placements? Has anybody, we heard from our college partners that faculty that potentially are either volunteering or able to get that, or maybe they're part-time faculty, they're able to get it to their work. Has anybody really taken a structured look at this, or is it really still kind of groping along in terms of being able to get the vaccine out to nursing and other clinical students?
So I know in our case, it's really kind of groping along. It's the reality of we've got a need. And so the first look is where can we deploy internal resources to help address that need? And so in some cases, we're looking to pharmacy staff. We're looking to other members who may have some experiences, some exposure, dental staff who may not be fully engaged in their current operation due to COVID. We're trying to leverage them. At the same time, we're also trying to deal with some of the realities of licensure, certifications, things of that nature, excuse me, which we're finding because of offices being shut down, places being shut down. There's been some cases where people may not have been able to get in to get that. And so we've been able to get some extensions. And I think what we're finding is the situation is such that we're having to rethink those boundaries. And we're starting to really begin to say to ourselves, if this is a population that can help us achieve this, how do we quickly bring them in, integrate them, extend services to them? And with the vaccine in place, I think that's one of the things that when you come on the team, you're now part of the staff, you're now part of the working. So there's that rationale that says, yes, we can vaccinate you. And then once we vaccinated you, having you in this workplace, having you do this space is a much safer, less risk adverse thing. So we're moving in that direction. And I just think, quite frankly, it's the reality of demand is pushing us to go in that direction. Because if we can't, there's no way we'll ever be able to meet the demand. You know, if you listen to the president, he's talking about 100 million shots in arms. There's no way we're going to get there with what we have.
Mm-hmm. Awesome. Thanks for sharing.
Ryan, if I may, really quick. My name's Macklin Hamilton. I'm the first-time attendee to HILT, so I really appreciate you all having me on the call. I'm with Cascades Job Corps, and we're a Title I-B young adult training program located up in Skagit County. And we recruit a lot of young people from the Seattle area and then in turn place them back in the Seattle area after they get their job training up here in Cedar-Woolley. And I guess what I'd ask is, hearing that our students can get clinical hours and provide support for people up here in Skagit County, and in turn then going back to King County, I need to kind of run this up the chain here, but if somebody would be willing to talk about who we might be able to get in contact with, what departments we should talk to get that clinical type support set up, that would be super helpful for us, because we have young people who are ready to help get shots in arms. So I'll go through Liesl after I talk to a couple people to get some contact information. But if you are at a college or some type of training program, I'd love to connect with you on how we might be able to roll that out up here. Really inspiring work that you all are doing. Really appreciate the opportunity to attend and look forward to talking with you more. So thanks for having me on.
Great. Thanks, Macklin. I appreciate you sharing that. And yeah, lots of different opportunities to be able to leverage for what really is truly going to take all of us to be able to get to that very auspicious goal. Anybody else that we have not heard from on the call just yet? So just kind of anybody else that has not had a chance to share from their experience, be that a college partner or any of our other industry partners on the call. Okay. Well, since we didn't do the breakout sessions, we're a little bit ahead of schedule. Just to kind of summarize some of the things I think that are some low-hanging fruit for potential collaborations. One, I do see that Denise put in the KP contact for student nurses. So for our college partners that are looking for those opportunities, that is a great way to be able to connect right away to be able to do that. And again, you know, Kaiser is really all over our region, so that's a great resource there. And then I think, you know, as again, once those supply issues begin to unclog, it appears we're going to have a lot more of particularly the community health partners like Health Point, really needing that support to be able to be there. And just in the chat, there was a question about, you know, okay, if you're starting as a volunteer is great, but you know, this is important, and you know, we're going to be able to pay folks. And thanks for DJ3 for responding that volunteering or getting those clinical placement hours that contribute toward that degree is a great foot in the door to be able to move into that full-time employment opportunity. So we definitely want to make sure that the opportunities are able to collaborate together. I do really also appreciate the really robust discussion, and thank you, DJ3, for showing for talking about and sharing your wisdom about how we reach out to communities that have that learned experience and distrust, and that hesitancy as a word sometimes kind of minimizes that, and that really we need to recognize that it is personal experiences in communities that that need to be listened to. And thanks for sharing the resources that are there. So I think those are great ways, again, those existing resources being put out by NAACP, and then the Zoom event that the DJ3 threw out. Those could be great opportunities for our college partners to be able to share with their students, to be able to learn and be able to listen from the different communities. But I think we're all recognizing that while there's some great work or some attempts going on there, it's really going to be a collaborative effort to be able to provide that assurance and education, and to make sure that all of our communities are able to visit or to be able to benefit from the vaccine as it comes out. So I want to give a special thank you to Dan and to Vicki, and I think we'll see who else is on the call, and Leslie for sharing and being able to join the panels, as well as all of our great industry partners, and Kim from being able to share from the experiences that she has, and DJ3 for getting us off to an animated and motivated start today, like he always does. So we will get 15 minutes back. We will capture all of these links in the chat, and Lisa will, when we send out our recap, those will be there. So if you missed something as this great conversation has gone by, don't worry, we'll be able to get that out there. So with that, thanks again, everybody. We'll look forward to seeing you at the next HILT events, and look for the date of the next info exchange next quarter as well. Thank you again, and have a wonderful Wednesday.
Thank you, Ryan. Bye, everybody. Good to see you all.
Thank you. Bye-bye.